The mission of the Hispanic Health Coalition of Georgia as a 501c3, we've been established for over 32 years throughout the entire state and the region. Our direct laser-focused mission is to provide and assist in advocacy, policy, and education to better health outcomes in chronic diseases, comorbidities, and mental health issues within the Hispanic Latino population of our state and throughout the region itself. Partners with the Hispanic Health Coalition are critical to our work. Stakeholders have different subject matter expertise that we partner with in institutional type of situations, research and development and education, such as the Emory Universities, the University of Georgia's, departments of public health, also with clinicians who specialize in a direct relationship to comorbidities and chronic diseases with the specialty that they bring to the table. So in entirety, it takes a village to create what we're trying to do to have better health outcomes because the ranking needs to go forward in the state.
We need the whole group of people that want to help out to come together and we create amazing things. We can't, one person or one entity can't do it by itself. We need the whole entire healthcare system in this case to come out, help out, and the village needs to come together.
Public health is important because public health is the science that is meant to help people stay healthy, to live productive, good lives with a good quality of life. Of course, if your health is not well, then your quality of life is not going to be a good one. And so public health is meant to prevent disease, help people prevent disease. It is meant to also support people that might be sick in following the right kind of steps in getting better. And it also is meant to teach people how to live healthy lives. And so it is important for the community of Hispanic people in Georgia or in the country, but it's also important for anyone, really.
The partners for the Hispanic Health Coalition of Georgia have always been critical to our work. They bring certain subject matter expertise from a clinical perspective, from a research perspective, from a student perspective, who onboard and embed in the field with us. So they may have a specialty to cancers or HIV/AIDS, or as we see today in the scenario of mental illness, behavioral illness, and addiction. So therefore, for us to create our village and to have better health outcomes, we need all of our stakeholders, including the Emorys, the UGAs, the Departments of Public Health, and working with teams like CORE to bring it in unison to serve our population better.
Nuestra misión básicamente es abordar, como te decía anteriormente, la comunidad en las diferentes edades que tienen. En la edad escolar con los temas de desarrollo, la juventud con temas de farmacodependencia, manejo de sustancias psicoactivas, cómo prevenirlas y cómo impactar en la comunidad de manera general. En las crisis de los adultos, cuando tenemos dificultades en pareja, cuando tenemos dificultades familiares, cuando hay trastornos, patologías mentales dentro de nuestra familia, ya sean por accidentes o enfermedades físicas, impactamos de manera positiva, buscando llegar a esa comunidad hispana mediante asociaciones como Health Hispanic Coalition of Georgia. Buscamos hacer ese vínculo para entrar más fácilmente a la comunidad y generar impacto positivo.
Emory is committed to civic and community engagement. I'd say that you can see that by most of Emory students being involved in the local community, and they are committed to collaborative partnerships with the Atlanta metro area and local partners. Emory is working with HHCGA to conduct a rapid community health assessment so that we can generate more in-depth understandings and findings about the needs of the Hispanic and Latino community in Georgia to help inform HHCGA's programming.
Pandemics have a unique ability to highlight social inequities that are already present in society and target certain communities in particular. So public health is important because it's a field that highlights those inequities and then also tries to develop interventions that end up helping out the community.
As a community, we need to speak up. We need to make sure that we're putting the word out there and that we're connecting the resources to the community. So if the Hispanic Health Coalition's goal is that betterment of the community, then we need to make sure that we are touching the point. We're bringing it up to our events. We're bringing it to the community so that they know that it is okay to ask for help.
So we work together as a think tank throughout the state, which also encompasses health work that does field work, so that we know what is going on. We can work unilaterally across all populations, again, to better health outcomes, but to have our thumb on the heartbeat of what is going on so that we can see indicators of new pandemics that may be coming vis-a-vis polio, something that has to do with smallpox, any of the above, and also including mental health, addiction, and other physical ailments that all of us suffer as human beings.